Overweight and obesity are serious health conditions associated with several leading causes of death, including heart disease, stroke, and diabetes. Individuals who are overweight or obese can significantly reduce their risk of cardiovascular diseases by losing just 5 to 10% of their body weight through diet and exercise. While lifestyle changes are effective for many, some people may find it challenging to achieve significant weight loss. In these cases, doctors may recommend anti-obesity medications. In November 2023, the U.S. Food and Drug Administration approved tirzepatide injection, marketed as Zepbound, for adults with obesity or overweight who also have at least one weight-related condition like high blood pressure, type 2 diabetes, or high cholesterol. This followed its earlier approval under the brand name Mounjaro to treat type 2 diabetes. Tirzepatide is administered by injection under the skin once weekly. It is a unique obesity treatment that mimics two hormones, glucose-dependent insulinotropic polypeptide or GIP, and glucagon-like peptide 1, better known as GLP-1, which are naturally released after a meal. By activating receptors for these hormones in the brain, tirzepatide reduces appetite, increases feelings of fullness, and ultimately decreases calorie intake. In addition, the medication stimulates insulin secretion and reduces glucagon release from the pancreas, leading to better blood sugar control, especially after a meal. Tirzepatide also promotes fat breakdown and slows down stomach emptying, further aiding weight loss. The FDA's approval of tirzepatide was based on the results of two large Phase 3 clinical trials, SURMOUNT-1 and SURMOUNT-2. These trials involved adults with obesity or overweight who also had at least one weight-related condition. Participants received weekly injections of tirzepatide at different doses, 5 mg, 10 mg, and 15 mg, or placebo, along with a reduced calorie diet and increased physical exercise. These studies measured weight loss after 72 weeks. In SURMOUNT-1, which focused on adults with obesity or overweight without diabetes, those on tirzepatide experienced substantial weight loss. At the start of the trial, the average body weight was 231 pounds or 105 kilograms. People on tirzepatide had average weight reductions of 15% with 5 mg, 19.5% with 10 mg, and 20.9% with 15 mg. In comparison, patients on placebo lost only 3.1%. A weight loss of 5% or more is generally a clinically meaningful effect on metabolic health. In this trial, the majority, about 89% to 91% of participants receiving 10 mg or 15 mg doses of tirzepatide achieved this benchmark. SURMOUNT-2 involved adults with obesity or excess weight who also had type 2 diabetes. At the start of the trial, the average body weight was 222 pounds or 101 kilograms. In this study, patients who received tirzepatide 10 mg lost on average 12.8% of their weight, and those receiving 15 mg lost 14.7% of their body weight, compared to only 3.2% with placebo. A 5% or greater weight loss was achieved by 79.2% of the 10 mg tirzepatide group and 82.8% of the 15 mg group, compared with 32.5% for placebo. Tirzepatide can cause gastrointestinal side effects such as nausea, vomiting, diarrhea, constipation, and abdominal pain or discomfort. Site reactions and hypersensitivity have also been reported. It is important to note that tirzepatide is not a magic bullet. For successful and sustainable weight loss, a comprehensive approach combining a healthy diet and regular physical activity is essential. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.